Okay, so today is the 14th, Valentine's Day. So whatever, 5 weeks. I don't know what the day counts anymore are. So got allergy tested this morning. Brought the supplements I was taking per Dr. Gold's orders. The Therateers, which is a fish seed and flaxseed oil pill, and the vitamin C. Doctors, the allergist basically said, not sure. It's very hard to test for everything in these. Are there other options? They decided to retest me for the fish oil and flaxseed. So they did a full panel, which is pinprick test on my arms for food, and came back I'm not allergic to it. That includes all fishes. So in theory, the fish seed oil should not be affecting me. They had me go for blood tests, which will test the basically test fish and flaxseed oil. They found a blood test for flaxseed oil allergies. They said they didn't have an easy way or a way to test to see if I was allergic to either Zyrtec or Claritin, because I've heard of other people having problems because they developed allergies to those drugs while taking those drugs. But they didn't have a simple test, but they may refer me to another doctor for that. They wanted me to stop taking the supplements for a week until my follow-up appointment when they see the results of the blood test, so which is going to be interesting. I don't know how that delay will affect my high healing. Obviously, if I'm allergic to either of those, either the vitamin C or the fish oil pills, the Therateers, obviously at long term that's going to cause issues. So these things are supposed to be helping me generate more tears. So it's interesting, and I'm not really sure what I'm going to do, but I'm definitely leaning towards what's the worst damage that can do if I'm not taking these supplements for 1 week and then jump back on them a week, or get on a call with Dr. Gold to figure out an alternative. It would be interesting if I'm allergic to flaxseed oil. That would be, because in my perception, fish seems much more common. Yes, I don't know. So I'll be supplement free starting tomorrow, and we'll see if the red splotches, the hives all over my body go away on their own. And I'm still using, rather than going to step up my use of the topical steroid that my primary care physician gave me. So all this interesting stuff going on in my world healing eyes. One other thing, I don't know if I mentioned in yesterday's update, Dr. Gold told me I could stop using the nighttime pills, not pills, eye drops, nighttime eye drops. So I didn't use them last night, woke up this morning, opened my eyes, my right eye was perfectly fine. It felt like there was something in my left eye was perfectly fine. Felt like there was something in my right eye when I opened it. So I think I'm going to just do another week of those nighttime eye drops and see if that has any effect. I didn't bring the eye drops to the allergist, so I don't know if those, it's just like, I don't know, any of these supplements, it'd be surprising that they were causing any issues, especially if the prick pin test says I'm not allergic to fish. So I'm going to use the Refresh PM for another week. That's my decision, and then see if anything, if I still feel like there's something in my eye when I wake up. And I'm also reducing my use of the Refresh Optive eye drops based on Dr. Gold said at least 4 times a day, which is fine, but I can do it as much as I want. So I'm going to purposely try to scale back. I was doing it every 1 hour when I feel worse, or actually I was every 2 hours rather when I feel worse. I was scaling it back and scaling it up and doing it even more. So, but I do find, I have noticed, and I noticed this in the past too, the less eye drops I take, the better my vision. So I think that it's supposed to help with healing, which is why I'm forcing the eye drops in there. But there has to be a balance, and if I scale back and have better vision while still giving me enough to heal, that's it's probably probably better for my work productivity. Yeah, that's that update.